If you are over 60 and dealing with burning feet, numb toes, electric shocks, or tingling, or unsteady balance, these feelings are not just some strange or unavoidable part of aging. They come from a biological environment in your body that has slowly changed over many years. Most people hear that peripheral neuropathy means nerves simply wear out with age, like an old machine gradually slowing down. Some are told it is genetic and nothing much can be done. Many get the sense, sometimes directly, sometimes indirectly, that the only real choice is to control the pain and accept things getting steadily worse. What is rarely explained is that nerves do not break down randomly. They react to the chemical surroundings, to blood flow, and to the metabolic messages they get every day. When that environment becomes harmful, nerves suffer. When it turns more helpful, nerves can often hold on to more function than people expect. Peripheral neuropathy is not a single disease. It is a pattern of nerve damage. It describes what happens when peripheral nerves, the long pathways linking the brain and spinal cord to the rest of the body, start to malfunction. These nerves handle signals for feeling, movement, balance, temperature, and pain. Because they are long and need a lot of energy, they are especially sensitive to problems like unstable blood sugar, poor circulation, inflammation, and lack of nutrients. That is why symptoms usually show up first in the feet and hands, the farthest points from the heart, most reliant on small blood vessels. A key thing to know is that nerve damage builds up quietly for a long time before symptoms appear. For years, even decades, nerves handle steady but unnoticed metabolic stress without obvious signs. During this hidden stage, damage grows. Proteins in nerve fibers change shape, blood vessels get stiffer, the protective coating thins, and electrical signals slow or lose accuracy. The nervous system covers for it for a while, hiding the early problems. By the time burning, numbness, or unsteadiness shows up, the damage is already advanced. This delay is why neuropathy often feels sudden and unfair, even though it developed step by step. In many cases, a main cause is a set of compounds called advanced glycation end products, or AGEs. These form when glucose molecules attach permanently to proteins and fats in the body. The attachment is not harmless. It alters the structure and function of those tissues. Once formed, AGEs are hard to clear and build up over time. They particularly harm tissues that need flexibility, precise signaling, and good microcirculation, making peripheral nerves an easy target. To see why AGEs matter, think about the molecular process. Glucose is vital fuel, but it is also chemically active. When blood sugar stays high for long periods, glucose bumps into proteins more often. In certain conditions, this creates permanent, stiff, sticky connections. It is like how sugar caramelizes when heated in cooking. In the body, it happens slowly and steadily when glucose control is not optimal. The outcome is tissue that is less flexible, less effective, and more likely to become inflamed. Inside peripheral nerves, AGEs hit three main targets at once. First, they change the nerve fibers themselves, disrupting proteins needed to send electrical signals. Second, they damage the myelin sheath, the fatty layer that allows fast, smooth signal transmission. Injured myelin slows, weakens, or twists the signals. Third, AGEs harm the small blood vessels that deliver oxygen and nutrients to nerves. These tiny capillaries are essential for nerve health. When they stiffen or narrow, nerves become starved and weak. This three-way effect explains the range of symptoms: burning pain from irritated, overactive fibers, numbness from missing signals, tingling from uneven firing, weakness from poor muscle signals, and balance issues from unreliable sensory input to the brain. Symptoms vary in mix and strength, but the basic pattern is often the same. One commonly missed fact is that fasting blood sugar gives a limited view of this process. Many with neuropathy hear their glucose is normal because fasting numbers fit the reference range. But fasting only shows the daily low, not the harmful highs. The biggest risk for AG formation happens after meals, when blood sugar climbs and stays high for hours. These repeated post-meal spikes cause nerve damage over many years. As we get older, the body gets less good at removing glucose from the blood. Muscle mass drops, insulin sensitivity falls, and sugar hangs around longer after eating. This does not mean aging itself causes neuropathy. It means aging lowers metabolic flexibility. When mixed with typical modern habits, frequent snacks, late eating, and processed foods, it creates perfect conditions for Ag buildup. Vitamin B12 has another important job. It helps keep myelin healthy, supports DNA production in nerve cells, and clears harmful waste. B12 absorption often drops with age and gets worse from drugs like acid blockers and metformin. Low B12 removes a vital protective layer for nerves, letting damage grow instead of being fixed. Regular blood tests can overlook functional B12 deficiency. Numbers may look normal, but still not be enough for nerve needs. This gap leaves many at risk without knowing. By the time symptoms start, the shortage may have lasted years. Dietary ages are another often ignored piece. Ages form not just inside the body, but in food too. High-heat cooking, grilling, frying, roasting, browning creates lots of preformed ages. These get absorbed and add to the body's load. Even with good blood sugar control, some cooking habits can speed up tissue damage. Switching to gentler, lower heat methods cuts this intake a lot. Once damage starts, inflammation makes it worse. Ages trigger immune reactions that keep chronic nerve irritation going. This is why symptoms often get stronger at night, when circulation slows and inflammatory signals stick around. It also explains how neuropathy messes with sleep, starting a bad cycle. Poor sleep worsens insulin resistance, raises stress hormones, and increases next-day glucose spikes, which create more ages and inflammation that hurt sleep even more. Movement is one of the best ways to break this cycle. Muscles pull glucose from the blood after meals. Even short walks can lower post-meal sugar levels quite a bit. This is not mainly about losing weight or hard exercise. It is about better metabolic control. Regular movement cuts the raw materials for ages and improves blood flow to nerves. Muscle strength matters too. Losing muscle reduces glucose uptake. Gentle resistance exercises keep muscle, support metabolism, and help protect nerves indirectly. This benefit is often underappreciated because it works slowly, not with instant relief. Hydration helps blood flow and metabolic cleanup. Dehydration makes blood thicker, lowers capillary flow, and concentrates glucose. Many older adults drink less without noticing, quietly raising nerve risk. Steady fluid intake supports vascular health with little effort. Stress affects neuropathy through hormones. Long-term stress increases cortisol, which raises blood sugar and promotes insulin resistance. Stress by itself does not cause neuropathy, but it worsens the metabolic conditions that harm nerves. Simple stress reduction methods ease this load and help stability. One of the worst beliefs about neuropathy is that worsening is inevitable. This thinking stops people from acting and leads to accepting decline. While badly damaged nerves may not fully heal, many partly affected ones can stabilize and work better in a better environment. People often say pain drops, balance improves, sleep gets better, and life quality rises when new damage slows or stops. The aim is not perfection, it is protection. Every hour of steady blood sugar is an hour free from chemical attack on nerves. Each better night of sleep aids repair. Each drop in inflammation improves signaling. Over time, these gains add up, just like the earlier losses did. Peripheral neuropathy is not just a nerve problem. It is a metabolic issue that shows up first in nerves. Seeing it this way changes it from an unstoppable fate to something you can affect. The focus moves from just handling symptoms to studying the root causes. This gives no promises of miracles, but it offers something more dependable, control over the process. And that control really counts. As people see that peripheral neuropathy comes from ongoing metabolic stress rather than abrupt nerve failure, another insight often comes up. The nervous system does not work alone. It constantly connects with other body systems. Blood vessels, muscles, hormones, immunity, and the gut all affect whether nerves stay strong or weaken. This connection explains why neuropathy is rarely by itself. It usually comes with fatigue, sleep issues, digestive changes, balance trouble, or mild brain fog. These are not separate. They are different signs of the same basic imbalance. A frequently missed factor is ongoing high post-meal blood sugar that does not qualify as diabetes. Many spend years in this in-between state, where glucose spikes too much and stays high too long after eating, but tests stay normal. In this period, ages build quietly. Without a clear diagnosis, people feel safe that nothing big is missed. But neuropathy does not need a label. It reacts to continued exposure. Nerves respond to the chemistry around them, not to test cutoffs. Glucose removal relies heavily on muscle. After meals, insulin tells muscles to take in and store sugar. When muscle mass falls, this process weakens. Glucose stays in the blood longer, extending glycation. This is why neuropathy risk rises with age, even without weight gain. Even slim, seemingly healthy people may have lost a lot of muscle, especially without strength training. This muscle-glucose link also shows why activity gives strong nerve protection even without diet changes. Regular short walks after meals cut spike size and length. Over months and years, this means fewer ages, less inflammation, and better circulation. The impact starts small but becomes important. It tackles the cause more directly than symptom-only approaches. The vascular system is central too. Nerves depend on a fine network of small vessels very prone to glycation and oxidative stress. Ages make vessel walls stiff, lower nitric oxide, and reduce needed widening. This leads to ongoing mild oxygen shortage, especially in far-off nerves. Feet get hit first not because they are weak, but because they are farthest from the main supply. This blood vessel aspect explains why symptoms often worsen in cold or at night, when circulation naturally drops. It also makes clear why past smoking raises risk, vessel damage lasts, and adds to metabolic harm. Inflammation runs through the whole process. Ages activate receptors that start inflammatory chains. These increase oxidative stress, harm nerve cell energy centers, and worsen insulin issues. Inflammation comes from damage and drives more damage. This loop explains why neuropathy can speed up after symptoms start, even without lifestyle shifts. Sleep is a vital repair time. In deep sleep, inflammation falls, insulin sensitivity rises, and growth factors help upkeep. Neuropathy that breaks sleep shortens this recovery window. Over time, poor sleep harms metabolic control and speeds nerve damage. This two-way link means even small sleep gains can bring big benefits. Eating late at night is especially bad here. Food near bedtime raises sugar when insulin sensitivity is lower. This extends high glucose and disrupts overnight repair. Shifting the last meal earlier often improves sleep fast and slowly eases neuropathy symptoms. No new foods or drugs needed, just timing that matches natural body rhythms. Gut health affects nerves too. The digestive system handles nutrient uptake, immune balance, and inflammation control. Poor digestion or ongoing gut irritation can limit absorption of B vitamins, magnesium, and other key items. It can also spark body-wide inflammation. Gut problems rarely cause neuropathy alone, but they raise risk and slow recovery. Helping gut function improves the nerve environment overall. Emotional sides need attention too. Ongoing discomfort, uncertainty, and fear of getting worse can spark anxiety or depression. These disrupt sleep, raise stress hormones, and lower drive for self-care. This creates another cycle, mental but deeply physical. Breaking it needs empathy, support, and realistic hopes instead of self-blame. Not all neuropathy is metabolic. Autoimmune issues, infections, toxins, chemotherapy, and genetics can damage nerves too. Still, metabolic health affects how bad it gets and how fast it moves in those cases. Studying blood sugar, cutting inflammation, and supporting circulation help nerves no matter the starting cause. This makes metabolic steps foundational. When people adjust to steady their metabolic environment, improvements often come quietly. Pain may ease a bit. Sleep gets better. Balance feels steadier. Temperature sense might return partly. These shifts can pass unnoticed if big reversals are expected. But they matter. They show slowed damage and better work from remaining nerves. Track progress over weeks and months, not days. Nerve recovery is slow. Metabolic changes take time. Ups and downs are normal. A tough day does not erase gains. Looking at longer trends gives a true picture and avoids discouragement. In advanced neuropathy, the main goal is preservation. Stopping further function loss greatly improves daily life. Less pain, better sleep, and more stability support ongoing independence. These gains count even without full feeling return. Medical guidance stays essential. Sudden or fast worsening symptoms need checking to rule out other causes. Symptom relief drugs should not stop without doctor advice. Lifestyle steps support, not replace, medical care. Research is redefining neuropathy more and more. What was once seen as inevitable aging is now viewed as a changeable process shaped by lifestyle, metabolism, and overall health. Full recovery is not possible for everyone, but many have more say over their path than once thought. The biggest change is in viewpoint. Neuropathy does not just happen to people. It grows in a specific internal setting. Change that setting, and you change the result. Not right away or fully, but meaningfully. Long-term handling of peripheral neuropathy relies more on steady small habits than on big fixes. Nerves respond to consistent patterns, not occasional perfection. One good week followed by a long slip does little. But modest positive steps kept over years can shift the path of decline. This may feel slow in a world wanting fast answers, but it matches how nerves really adjust. Aging brings natural shifts that raise neuropathy chances. Insulin sensitivity drops, mitochondrial work falls, and mild inflammation creeps up. These happen even in people keeping healthy weight and looks. The shifts are slow and easy to overlook until symptoms show. Seeing this reframes neuropathy as the slow buildup of small changes over decades. Aging also weakens nerve muscle links. Motor neurons gradually pull back from muscle fibers, leaving some underconnected. Remaining neurons try to make up for it, but there are limits. Over time, movement accuracy drops, balance precision falls, and nerve muscle signals weaken. This raises fall risk and cuts activity, speeding muscle loss and metabolic problems. Foot care becomes very important as neuropathy advances. Less feeling raises the chance of missed injuries, ulcers, or pressure sores. Daily foot checks turn into a must-do habit. Good shoes, moisturizing skin, and watching for calluses or nail issues help prevent big problems. Many serious neuropathy disabilities come not just from nerve damage, but from avoidable foot issues that went unnoticed. Chronic pain changes brain handling. Sensory, emotional, and focus areas get oversensitive. This central sensitization boosts pain and lowers tolerance. Neuropathy care, therefore, includes calming the central nervous system. Methods like slow breathing, mindfulness, or light activity can reduce symptom strength even when outer damage stays. Pay attention to key nutrients for nerve support. B12 shortage can mimic or worsen symptoms. Magnesium aids nerve signaling and relaxation. Supplements should come after testing and doctor advice, but knowing helps spot fixable factors. Hydration affects blood thickness and flow. Mild ongoing dehydration limits microcirculation and cuts nerve oxygen supply. Thirst sense often weakens with age, raising risk. Steady, suitable fluid intake strengthens circulation. Social ties bring unexpected benefits. Loneliness increases stress, harms sleep, and lowers self-care drive. Keeping connections with family, friends, or groups supports emotional health and indirectly helps physical results. Activity often feels easier and more regular with others, adding metabolic gains. Fear of decline can quietly limit choices. Some skip movement to avoid pain or falls, but this speeds worsening. Swapping fear for informed steps is key. Adapted exercise is safer than doing nothing. Nerves gain from gentle stimulation. Inactivity tells the body an area is not needed, lowering repair focus. Regular doctor visits for chronic issues can feel rushed or short. Coming with clear notes on symptoms, changes, and questions improves talks. Speaking up for yourself betters care. It is not arguing. It is needed for good ongoing management. Caregivers need support too. Seeing a loved one's constant discomfort is hard. Knowing progress is uneven and ups and downs normal helps set expectations. Helping caregivers ultimately helps the person with neuropathy. Over time, the effect of small helpful choices shows clearly. Those who focus on metabolic steadiness, movement, sleep, and emotional health often see slower worsening and fewer issues. Symptoms may stay, but they get more manageable. Life stays active and satisfying instead of limited. The strongest idea is this: neuropathy is a condition, not who you are. You're a person with history, relationships, skills, and goals. Keeping this view stops the condition from taking over life more than it has to. B vitamin levels deserve early attention. Regular checks of B12, folate, and B6, especially after 50 or with drugs like metformin or acid reducers. Catch shortages before nerve health suffers. Early fix, through diet, sublingual, or shots when right, strengthens myelin keeping and repairs systems that build nerve toughness. Hydration, sleep, and stress control are preventive basics. Enough daily water keeps blood thin and microcirculation good. Steady good sleep protects the nightly repair time when inflammation drops and insulin sensitivity rises. Simple stress relief steps, deep breathing, short walks, nature time, stop ongoing cortisol rises that push glucose up and insulin resistance. For families, prevention brings shared gains. Many nerve-protecting habits also lower risks for heart disease, brain decline, type 2 diabetes, and other age issues. When older family members show earlier meal timing, regular movement, gentler cooking, and nutrient focus, younger ones pick them up naturally. Kids and grandkids learn metabolic health is built daily, not lost later. Talks about neuropathy can shift from scary warnings, "You don't want this," to empowering, practical tips, "Here's what I wish I'd started sooner." Sharing easy changes, like family walks after dinner or milder cooking, makes prevention feel doable, not overwhelming. Screening matters too. Steady tracking of fasting glucose, HbA1c, and, when possible, post-meal levels spots early metabolic changes. Even in normal ranges, a slow upward trend over years can encourage small shifts before lasting damage. Asking about B12 and other nerve support nutrients at checkups is another easy preventive step. One of the best preventive mindsets is curiosity instead of acceptance. Rather than thinking nerves just fail with age, those who stay curious about how daily choices affect biology make more protective choices. They notice how certain foods, late eating, or routines impact energy, sleep, or faint foot feelings. That noticing drives steady improvements long before symptoms force attention. Prevention is not about perfect performance or no decline. It is about gathering small protective factors year after year so the downward path softens a lot. Someone in their 70s or 80s with just occasional light tingling, good balance, and decent feeling has usually followed these ideas quietly for decades, not through extremes, but through steady habits. The information here is not secret or too complicated. It comes from decades of research on metabolism, glycation, inflammation, nerve work, and aging. What has often been missing is a clear, practical way to connect these pieces, especially for those over 60 dealing with symptoms or helping loved ones who are. Peripheral neuropathy does not have to be a mysterious or unstoppable sentence. It is a signal, a late warning that the internal environment has drifted too far from balance for too long. The hopeful truth is that the same environment allowing damage can usually be gently steered back toward conditions that slow, steady, or partly restore function. You do not need to reverse decades of change in a day. You just need to stop adding to the problem right now and keep that going tomorrow and onward. Each hour of balanced blood sugar, each gentle walk, each better sleep night, each reduction in inflammation adds a small vote for nerve keeping. Over months and years, those votes pile up. They do not erase all damage, but they change the story from certain worsening to handled stability, from giving up to realistic hope, from no power to real influence. That shift, from nothing can be done to I can influence a lot, is where real change begins. And once it begins, it usually keeps going.